Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. In our previous session, as we have discussed about hygiene, the care of skin as well as the care of eye, in this session we are going to discuss about a very small topic, which is the care of ear and nose. So when we talk about ear, here normal ear requires minimal hygiene. However, when you encounter those clients who have excessive production of cerumen, or we can say the earwax, or those clients who are dependent on hearing aids, then they may require an assistant from a nurse in order to provide this ear care. This ear care is a routine procedure which is performed in order to remove the excess earwax, or we can also say the cerumen, as well as the foreign materials from the ear. As we know that the ear naturally secrete earwax to protect, to lubricate the ear, to keep the debris out, as well as to hinder the bacterial growth. However, excessive earwax production can also pose a major threat and can also lead one to suffer from many ear disorder. That is why ear care is very important for each and every individual. What is the purpose of this ear care? The first one is to maintain the proper hearing aid function. The second is to encourage the client for using the proper technique for cleaning the ears. The third is to follow the preventive guidelines for hearing loss. And the last one is to help the client with hearing loss to communicate properly. So these are the purpose of ear care. So here, whenever you as a nurse is about to provide this care to any client, you need to make sure that you arrange all the required articles, right? So the articles which is required for providing this care consists of the cotton ball, warm liquid paraffin, or even the vegetable oil, the client hearing aid, the soap, water, or towel, a damp cloth, as well as a pipe cleaner or a toothpick if it is required. So here, these are the various articles that you must make sure you arrange it before you provide this care for the client. So after you have arranged all these articles, the next thing you must do is that you must prepare the client. So how can you do this? The first thing is that you must instruct the client in the proper way to clean the outer ear. And you must also advise them to avoid using the cotton tip applicators or any other sharp objects such as the hairpins, because this can cause impact of cerumen deep in the ear canal as well as can cause trauma. You must also tell the client to avoid inserting any pointed objects into the ear canal. And when you encounter any elderly client who is above 65 years of age, then you must advise them to go on a regular hearing checkup. And when you encounter any client with hearing loss, you must make sure that you instruct the family members to avoid shouting, but instead speak in low tone, as well as you must advise them to make sure that while they are speaking, they must make sure that the client is able to see the speaker's face. So these are the various things that you must instruct the client as well as the family members. Now moving on to the next, which is the procedure. So here, whenever you are providing this ear care, you first need to verbally confirm the identity of the client by asking their full name or even their date of birth. You can then ensure the verbal consent from the client. And how can you get this consent? You can get it by first explaining the procedure to the client as well as explaining the risks and the benefits so that you can gain this consent from them. And even before you perform the examination of the ear, you must first listen to the client, to their concern, to their problems, as well as to the symptoms which they may be having, so that we will be getting an idea of what the condition may be even before we examine the ear of the client. And after the examination has been done, if you found that there is some abnormalities, then you can record it in the patient's record, or if there is no abnormalities, then you can proceed on with this procedure. So here, the first step that you must do is that you must make the client sit in an upright position and place a towel on their shoulder in order to capture the water that drains from the ear. Then they can gently pull the ear upward and backward in order to allow the water to enter the ear more easily. And then you can place the syringe in the ear. And here, when you do this, you must make sure that you insert it up and to the back of the ear. because this position will help to separate the earwax from the ear, and in this manner it will also easily drain out of it. Then you can gently press on the syringe in order to allow the water to enter to the ear. And when you are doing this, if the client says that he is having pain, discomfort, or even pressure, then you must stop doing it. Then you can dry the ear by using a towel or even by inserting a few drops of rubbing alcohol into the ear. So these are the various steps that you need to follow whenever you are providing the ear care to the client. So this is about the eye care, where we have discussed about what eye care is, what are the purpose, what are the equipments which will be required, how can you prepare the client, as well as what are the various steps that you must follow whenever you are performing this procedure. Now moving on to the next, that is the care of nose. So the nose is the external midline projection from the face. Its purpose is to warm, clean, as well as humidify the air that a person breathes. In addition, it also helps a person to smell and taste. This nose is divided into a two passage ways by the partition known as the septum. Opening to these passageways are the nostrils and the bony projection called the turbinates, which protrude into each breathing passage because they are the one which will be helping to increase the surface area of the inside of the nose. So as I've said, that the main purpose of this nose is to warm, clean, as well as to humidify the air that a person breathes. And this nose is also responsible for a person to taste and smell. That is why it is very important that we must provide this care of nose to those clients who are not able to do it by themselves. The purpose of this is to prevent the bacteria, to clean the patient's nose, to prevent or treat any injury that may occur to the nose, as well as to prevent any damage to the nose. The equipment required is the cotton balls, the water, or even the normal saline, as well as the towel. So before you perform this procedure, you need to make sure that you prepare the client, and you can do this by first explaining the procedure to the client and also by explaining on how the client himself can help you in that procedure. Then you must adjust the bed so that it will be easy for you to perform this procedure. Then you must arrange all the articles conveniently on the bedside table of the client. And you must provide only one pillow, which must be placed under the head, and remove all the extra pillows. So after you have explained the procedure and after you have arranged all the articles, the first thing you must do is you must wash your hands. And after you have performed your hand washing, then you must place the patient head well supported with tilted back. You must make sure that enough light source is available in order for you to carry out this procedure easily. Then you must start removing the nasal secretion of the client by the use of the cotton balls as well as of the water. And while you are doing this, you need to ensure that a new cotton ball is used each time, and you must repeat this procedure until all the secretions has been removed. And once the secretion has been cleaned, once the nose has been cleaned, then you must dry it. And once you have cleaned and dried it, then you can also return the client back to their normal position. Then you can discard the waste according to the hospital policy. You can replace back all the articles. You can then wash your hands thoroughly, and once this is done, then you must make sure that you record the procedure in the nurse's record. So here, these are the various things that you must keep in mind whenever you are providing this care of nose for the client. So now here we have come to the end of this topic, whereby in today's session we have discussed about the care of ear and nose. I hope you have got a clear insight of this topic. I will be meeting you in another session. Until then, have a good day. Thank you.